Welcome to Money Matters. I'm DCrowell from Mortgage Network, and I'm going to talk in the first segment of the show about healthcare as economic policy and its potential impact on us all and on the economy in the coming 6 to 12 months. It's a huge subject, so I'm going to touch principally on those aspects of the great healthcare debate that have the potential of impacting the economy. To begin with, healthcare in all of its manifestations represents the largest single segment of the economy. The entire U.S. economy, entire gross domestic product taken together, healthcare and its various manifestations represents about 16 to 18% of the entire economy. The actual health needs of the population, if everyone had health care, could in theory be met by about somewhere between 30 and 40% less than we're spending. And therein lies the big debate. What everybody agrees is that there are two economic issues associated with healthcare, or two major issues associated with healthcare. One is how to get coverage, how to get universal coverage, how to make healthcare available at a reasonable level to everyone in the society. Remember that every single industrialized country in the world has universal health care except the United States. So issue number one that pretty much all Democrats and all Republicans agree with is that universal health care is the pressing objective. The other, and not entirely separate, but separate objective is to somehow address the delivery system and with it the cost of health care, because health care in the United States is very, very noticeably more expensive than in any of the other industrialized nations. So we have two challenges here in the United States. We have the challenge of not having universal coverage, and we have the challenge of having the most expensive delivery system. So lots of debates arise out of the possible solutions to those two problems. Everybody pretty much, Republicans, Democrats alike, pretty much agree with my statement just now of what the two problems are. What they don't agree with is one another as to the solutions to those two problems. The simplest of all conceptual, intellectual solutions is that in any given population, in any given society, there is a cost of health insurance based on per capita, based on the individual members of that population. So if you have a population of 1 million people who are young, middle-aged, and old, babies, young people, babies, children, young people, middle-aged people, elderly people, and people who are entering their end-of-life years. If you have 1 million people on the nose, then if you look at the entire medical cost for that 1 million people, you have the base number and problem number two, which is the cost of insurance. That's where insurance in the U.S. is extremely high. In socialist Scandinavian countries, in social democratic countries in Scandinavia, cost per capita, taken the million people as a whole, is much lower. That has led to a theory. And the theory is that the simplest of all healthcare systems would be one that has a capitation rate. It sounds like an associated word decapitation, which is unfortunate because that would mean cutting your head off. But a capitation rate is a rate that you would set aside, an amount of money that you would set aside for each and every person in the society. Each and every person must pay that rate. And that rate is simply the cost of all the insurance for the million divided by 1 million and paid equally by all million of the people. So when a baby is born, it has the capitation rate, let's call it $2,500. And when a person is old and in the last 2 or 3 years of their lives, they would also have a capitation rate of $2,500. Their consumption rate is widely different. Babies consume more than 5-year-olds. 5 to 15-year-olds consume very little. 15 to 25-year-olds consume a bit more, and so forth, up to 83 to 88-year-olds who consume far more than their per capita share of the population. So that's a consumption rate versus a capitation rate. For the simplicity of the argument, the most elderly people in our society may have a consumption rate that is $50,000 per annum versus a capitation rate of $2,500. A 15-year-old may have a consumption rate of $200 versus a capitation rate of $2,500. But the pool supports exactly and precisely to the penny the whole. Now, that sounds very simple in concept. Making it work in real life is more difficult. In real life, the way that you make it work is you completely reorient the market system that supplies healthcare and put a very heavy premium on outcomes. In other words, what you want to have happen is for each and every person throughout the system to consume less medicine. You want them to be healthier. The Geisinger Institute in Colorado has been following, and there's I believe it's also in Northern California, has ensured a large group of diabetics and heart patients, and has seen their illness and consumption of cost of medical care go down by over 50% because of a very interesting medical technique. What the Institute has done is to supply each diabetic up to $2,000 a month in free groceries. By providing up to $2,000 a month in absolutely free groceries, this is not for poor people, this is for just if you happen to be a diabetic, we'll give you your food for free. Your medical provider will give you your food for free. A very interesting thing happens. Their medical costs absolutely plummet. The huge cost of treating diabetes-related eye surgeries, diabetes-related liver failure, heart failure, and all of the other diabetes-related issues absolutely plummet. Therefore, the consumption of medical care plummets simply because the people involved are eating all the right food. They're incentivized to eat all the right food because it's great food and it's given to them free. So that's a simple test example. It's a big test, and it works. But translating that to national health policy, very, very difficult. Is it the job of the government to put in place a solution to the cost of medicine problem? Is it the job of the government to mandate universal coverage? Should it be just a societal consensus that both of these things happen and that the free market will somehow work its way out, or should the government really have its hand on top of both of these issues? Therein lies the essential rub between traditional conservatives and traditional liberals. Until such time as we can get past the shouting and screaming, it looks like we're going to have the most expensive medical system not in the world, not in the industrial world, and not have it delivered to all of our citizens. That's it on medical care for the moment. We'll see you in the second half of the show.